Good afternoon to my fellow classmates. Today I want to speak to you about a topic that's near and dear to my heart and involved my family in a very dramatic way. One day out of the blue, the phone rings, and to my surprise, it was the hospital calling to let us know that one of our family members had been admitted to the hospital. This person was admitted due to trying to commit suicide. As I dropped everything that I was doing to run to the hospital, I had no idea what was about to be discovered and the major impact that it would have on our lives, something that I could never imagine. That's right, my family member was diagnosed with depression and had tried to commit suicide for being severely depressed. So today I would like to talk to you about depression and what causes depression, the symptoms related to it, the types of people that are affected by it, and different forms of treatment. Depression is described as a feeling of deep sadness, and it affects your well-being and the way that you think and the way that you feel about yourself. It's often described as a medical illness, not a sign of weakness, and it is something that is very treatable. You deal with intense feelings of sadness, and it's not just something that you can just snap out of easily, and it does require long-term treatment for help. Various causes for depression can be abuse, whether it's physical or emotional, which just happens to be the case with my family member. It was physical abuse. It could also involve a cause of death or loss, genetics, which would be a family history, or major events that take place in your life, like the loss of a job, or income changes, or a divorce. There are different symptoms that are involved when dealing with depression. Some include weight loss, persistent aches and pains, thoughts of suicide, or feelings of hopelessness, changes in your appetite, irritability, frustration, fatigue, loss of energy, and feelings of guilt. There are many people that are affected by depression in the world. WebMD says that there's approximately 19 million people that are affected by this disease. That's 1 in 20, according to the CDC. Some people that are affected are poor people. This number seems very high, mainly due to the fact that they do not have the resources to get the help that they need, and also because of their income levels being low. Rates are higher in older adults because sometimes the symptoms go undiagnosed, or they may appear to be related to a different type of illness. It also could be related to hormone changes. There are various forms of treatment when it comes to dealing with depression. Therapy is one form of treatment. This can be done as an individual, it can be done in group therapy, or it can be done with alternative healing methods such as using herbs. This is done by having a trained professional to work with the patient and help them to figure out what are the root causes of their depression. This person can help a patient identify skills to help deal with their depression and also help identify negative thinking and ways of combating that. Medication is another form which is widely used when it comes to treating depression. Antidepressants are widely used and prescribed for patients for their depression. This is depending upon the medical history of the patient, the severity of the depression, and sometimes the age of the person. Medication is used to help balance the chemicals that are causing an imbalance in the patient's brain. It is also the most advertised use of treatment for depression. Lifestyle changes are another way when it comes to treating depression as far as treatment is concerned. Exercise is very helpful to fight symptoms. And if you're a loved one of someone who suffers from depression, it is very helpful to encourage physical activity, as this might help to ward off depressing symptoms. Stress reduction and relaxation are very helpful ways of warding off depression. In conclusion, as mentioned previously, depression does affect millions of people across the country, and it can be caused by a variety of issues, from family history to major events in someone's life. There are several ways to deal with depression, and there's various symptoms that are associated with this illness, both mental and physical. A combination of therapy and medications and lifestyle changes can be very beneficial for someone who is suffering from this disease. These can all be done in conjunction together or separately, depending on the individual's needs. As a loved one of a person who is suffering from depression, it is good to learn more about depression, what causes it, symptoms, and how you can be supportive in ways to help the person not feel like they're an outcast or that they're not being loved. To get help with the illness, you should speak to your family doctor, or you could call 211, which is InfoLine in the state of Connecticut. This is a helpful resource for getting you referred to professionals that are available to help dealing with depression. Even though depression can have a major impact on someone's life, it is very helpful to know that there are various ways out there, and there's a lot of help, whether it's through medication, treatment, therapy, for dealing with this disease. As stated, depression is a medical illness, not a sign of weakness, and it is very treatable. So there's no excuse for anybody not to get the help that they need, regardless of income levels, age, or economic situations. As mentioned, there's various ways to get help, mainly through your doctor, or you can use the internet to look up various sites that can point you in the direction needed to obtain the information that you need. And as stated, it can cause a great impact in not only the person who's suffering from the disease, their life, but also in the life of the individuals that are involved with this person. But it is helpful to know that you are not alone in this battle. Thank you and have a great day.